Hi, welcome. This is Health Matters with me, Dishen Kumar, and today I am in Subang Jaya Medical Center to talk about something quite different. Now, in Health Matters, what we try to do is we try to give you issues and even diseases, certain things that we go through every day on our health. And what we always like to do is we actually talk to doctors. But today's focus is not going to be on doctors, but to someone also very important in the medical industry, nurses. So today with me is Erin Lloyd, who is the Group Head Nursing Quality and Risk Management for RAM Sime Darby Healthcare. That's a mouthful.
Yes, indeed.
All right, Erin, thank you for joining us today. Let's start off talking about nursing. Let's start off with the current numbers in the Malaysian medical industry.
Sure. Well, across the industry, particularly in the private industry, we're looking at turnover rates of 18 to 22%. So therefore, we've got a shortfall of nurses across Malaysia and, more importantly, across the world. There's a need for about 120,000 nurses in Malaysia, and we certainly are falling short of those numbers at present.
Okay, now let's talk about that falling short numbers. What could be one of the few reasons that you can talk about?
Right. Well, in Malaysia specifically, there's been a number of reasons that are impacted on that, some of which have included the changes in the requirements for nursing. I believe the 5 credit points have impacted. Previously it used to be 3 credit points. Yeah. So particularly having a credit point in maths and science has been challenging to attract nurses to the nursing profession. The other indicator that's really impacted we see is the number of nurses being able to get PDPD loans and the changes in that.
Yeah, because the PDPD loans now don't really, there's also changes in how much they can get from the loans as well.
That's correct, yes. And we're looking at 70,000 ringgit for a nursing course. So it's a lot of money if you have to pay yourself. And I believe most nurses are being sponsored by their hospitals and then bonded afterwards so that they can take on nursing as a profession.
Now, talking about that, can we move on into the fact that do the youths out there see nursing as a proper career choice, or is there a lot of them saying that they would rather go for more lucrative type or more glamorous type of jobs and things like that?
Sure. Well, that is the group of nurses I represent, think nursing is a wonderful profession and it's very exciting and every day is different. But there are lots of other occupations out there that are pulling females specifically, and we do have some males in nursing. But yeah, I guess there's so much choice these days. Yes. In the past, particularly for women, there was being a secretary, a nurse or a teacher. Now there's so many occupations that people can go into. I think generally though in Asia, my experience is that nursing is an evolving profession, that people don't always see it as maybe their first choice for university. And I think that's a real shame because nurses are the glue that keeps the hospital together. Exactly. They're there 24/7. And it's, for me, it's been a wonderful profession, and later today you're going to meet some of our senior nurses, and they equally feel that it's been a wonderful opportunity and a great way of life.
All right. Now let's talk about staffing in hospitals, currently in hospitals. What are the numbers? How do we have enough nurses in hospitals currently, and what type of things? And you talked about a lot of different other factors that stops or the numbers are dropping because of a few different things. What strategy is in place right now to try to get more people?
Sure. Well, we have Sime Darby have a college, so we have a pipeline of nurses that we train. So that's one way we see is keeping up our nurse supply. We are dealing at a turnover rate between 18 to 20%. So it's a constant thing of trying to get new staff to bring them into the hospital and train them up. One of the things though that we're looking at is we're improving their education, obviously in the college, but also when they start in the hospital. We have a program so that we orientate them to the hospital in the first year. We also provide them with postgraduate training. The Malaysian Ministry of Health likes 40% of its nurses to have postgraduate training. So that's in areas like operating theatre, ICU, the critical care areas, haemodialysis. So at our college we also provide those courses, so we're able to sponsor our nurses to do those courses as well. So we're creating a career path We're also looking at the environment. Hospitals are very dynamic. It can be a very stressful place to work. So looking at what happens in our workforce. So we found out from our engagement surveys how people are feeling, and then we work out action plans so that we can improve the work-life balance as well.
All right. Now let's move from Malaysia. Let's talk maybe, you've had experience in Malaysia, Indonesia and Australia.
Yes.
Let's try to talk about the trends, on the nursing trends in those three countries. How is that different in each country?
Well, all of us, there's a lot of similarities, so perhaps I could just mention a few of those first.
Yeah, sure.
So obviously the globalisation of healthcare, people moving around more, and certainly nursing is a passport to the world. You want to go and see it. But the impact of technology, digitalisation is some really challenging for us as an organisation, and not only adapting to the changes, like for example the electronic medical records, telemedicine, those sorts of things, but you've got to train people up to use them. You've got to have new policies and procedures. So there's some of the things that we find certainly keep us busy. Patients are more informed these days, and they come to hospital with a lot of information.
So too much information sometimes.
Well, I think in the past, personally, that the hospitals have been very focused on the hospital and not on the patient. So yeah, it can be challenging when people say to you, but that's not the right thing or that's not the right answer. But also, people are much better educated these days, and then they're more able to speak up if they are not happy with the situation. So, to be current in this world, in healthcare, we have to be prepared for patients when they come with this information and all the rest of it. The other thing is the ageing population. And dealing with patients as they get older with comorbidities. So they might present with one thing, but they've got 4 other things wrong with them. They might present with chest pain, but they've actually got diabetes and something wrong with their kidneys. So they're very challenging patients, and we have to learn to look after them more appropriately. So obviously we have to teach our staff how to care for them as well.
Okay. Now, let's talk about the relationship now between doctors and nurses. So, as long doctors have been in the medical industry, they've had nurses, and based on your own experience, how it used to be and how is it now, do you feel that there's still this, everybody thinks, the public thinks, even I personally think there's this huge chasm of a difference between doctors and nurses, but they actually work as a team. It's very important. Do you feel like now there's this change in where they can be looked at equals and to be looked at working as a team, or is it more of just do as what the doctor told you to? Like
Sure. Well, traditionally that certainly was the way, but I've seen over the time I've been a nurse, I've seen a real change in that, and I think the changes came when nurses became better educated, and certainly when they became tertiary qualified, and critical thinking became more part of the daily role of a nurse. So you found people speaking up, challenging situations. It still is a very hierarchical environment to work in, and most recently we've just implemented a program called Speak Up for Patient Safety, which allows us to be able to teach people how to speak up, and then if they've got a problem and they're not able to speak up in that instance, to input their situation into the computer, and then that situation is reviewed by an executive team of the hospital, and someone goes and speaks to the person who's been involved. So we've changed a lot from tolerating bad behaviour, and bad behaviour affects patient safety because people are less likely to contact them or to report things if they think someone's going to be rude and abusive to them on the phone.
Okay, now talking about that, the workplace hazards, bullying and harassment that the nurses go through, it's a lot. They have to take care of patients, you have to handle difficult patients, you also have to handle maybe we can say temperamental doctors and things like that. So you talked about the program. Do you see that program actually making a change in what is the type of cases or even the number of cases? Is it a lot number of cases?
Well, we don't know always because people don't always tell us about them. So, but generally the statistics around the world would say there are lots of instances. If you're talking to people in a coffee shop, you'll often hear them talking about situations. So it's changing those situations into, or at least making sure that we can turn those situations around. From a patient perspective and visitors, Ramsay Sime Darby has a zero tolerance to bullying and harassment, and workplace violence, whether it's physical or verbal, is a problem all around the world. Yep. So we as a management team have to make sure we provide a safe environment, not only for our patients, our visitors, our doctors, but also for our staff, and that's very much part of the program. In respect to our new program, which is the Speak Up for Patient Safety program, we're just going that little bit further in providing more assistance for people to speak up. And you know, in not only in Asia but around the world, nurses are less likely to speak up if it's the doctor-nurse relationship. However, over the years there's a lot more multidisciplinary teams working together, a lot more respect for the different members of the healthcare team. So I think there's been lots of changes, but we just need to go that bit further.
All right, okay. And I'm sure with the program you've set up, the more opportunities you give and the more empowered nurses feel, they will obviously speak up.
Yes, we believe with our program, which has only newly been implemented, that it will take time. It took time in Australia for people to speak up, a couple of months before they got any information in the internet system. But also I think it's what happens, you know, like people are concerned when they speak up that there'll be some retaliation. So I think that's what people are waiting for. And if there's no retaliation, then I think that we'll get more people to speak up. With our program too, we're not Pollyanna in the thought that everyone's perfect, and we have made it very clear to people you cannot put vexatious comments in the system, and vice versa. If the person comes and speaks to you about your behaviour, you can't go and apologise or follow up. It's just some advice, it's just feedback, and that's it.
Okay. All right, and thank you so much for your time. We'll be back right after this. More on nurses after this. This is Health Matters with me, Dishen Kumar.